Bob, do you want to talk a little bit about interactions between genes and environment, including nutrition?
So we're talking here about two dimensions of complexity. The first dimensions are the genes that we get from our parents, and the second dimension is the environment. And each one of those has multiple components. None of us can do anything about the genes that we got from our parents, but it's probably the case, according to some studies, that between 60 and 70% of women who get breast cancer actually have a predisposition to develop breast cancer. Only a small fraction of those are actually people who have damage to the notorious BRCA1 and BRCA2 genes. And it's probably the case that most breast cancer is what's called a polygenic disease, where there are 3 or 4 or 5 genes in our genome, the ones we inherit from our parents, that conspire, that collaborate with one another to significantly increase breast cancer risk. Unfortunately, we're not yet at the stage where our genetics can really identify those 4 or 5 or 6 genes and tell us which particular women are at increased risk and which aren't. If you have one gene you're studying, like BRCA1 or 2, then it's relatively easy for the geneticists at present. But the moment we get up to 2, 3, or 4, then the mathematical complexity of the problem really overwhelms virtually everybody who works in this area at present. So that's one area. Given the fact that we have inherited a particular kind of genes, can we tilt the playing field in favor or against our developing breast cancer? And you know as well as I do what the risk factors are which constitute the environment. We could almost include lifestyle as part of the environment, because much of the risk factors in terms of breast cancer, independent of the genes that I talked about before, are aspects of lifestyle. Smoking is a small factor. How many children one has is a big factor. How early in life one develops, one bears children, one's weight, one's exercise, and probably the makeup of one's diet. There's increasing evidence, it's still pretty weak, that the more vegetables you eat and the less high-fat, high-meat diets you eat, in general, you're probably destined to live a little bit longer. Does this guarantee a lifetime of uninterrupted by bouts of sickness? Absolutely not. But all we can do is play the odds at present, because there are so many distinct factors that converge on disease risk, independent of genes, that at present we can only identify some of the most obvious ones.